Hi, I'm Dr. Harish. I'm a consultant general pediatrician and a consultant pediatric cardiologist practicing at Jaws Center, Bangalore. Passage of stool in a newborn is variable. So in babies who are on breastfeed or maybe on formula feeds also. So it could be as varied as babies passing stools multiple times in a day, or it may be as low as about once in 3 to 5 days. So rather than counting the number of stools, it is important to look for the consistency of the stool. So the natural consistency is like curdy consistency. So any change in the consistency from this pattern may amount to constipation. So most of the time the constipated stools will be like hard pellet stools. A baby might cry during passing stools, and it may be putting excessive strain. So the buttocks and all these muscles, they start to clench and make it a forceful exit of the stool. Common mistake to avoid while giving formula feed is to use an extra amount of powder to the desired quantity of water. So if that is if extra amount of powder is used, it may cause dehydration in the baby, and that itself might cause constipation. So there is no particular formula which will help in smoothing the stools. So rather some babies end up getting constipation, but it's rather advisable not to change the formula feeds. Common mistakes to avoid during the formula feed is to use excessive amount of powder, which in turn can lead to dehydration of the baby, and that in turn leads to constipation. So babies who are on formula feeds, there is no necessity to switch over to an alternate formula feed. So the same formula feed can be continued. If there is a change of formula feed, so there is always a potential for harmful damage rather than being beneficial in nature. Also, the constipation can happen during transition from breast milk to formula feeds. So it is advisable to consult your pediatrician whenever the baby is having constipation, because it may not just be related to the formula feeds, but there may be some other underlying problem. So that needs to be addressed. So you please consult the pediatrician and let them take a call whether it is related to the formula feeds or any other underlying causes there, and that can be taken care of.